One of the most important lessons that I learned about CRT when I first began taking them years ago was to really pay attention to my electrolytes when my patient is on CRT, especially if my patient is on a 0K or 2K bag. Let's chat about it. My name is Leah. I've been a CVICU nurse for 18 years, and today we're going to talk about those 2K, 4K, 0K bags. When you see numbers like 4K, 2 calcium, or 0K or 2K, those numbers are telling you about the electrolytes inside of the bag. We know that 4K of potassium is usually a normal number of potassium that we would find in a patient's blood. We're going to use this if the patient's potassium is pretty close to normal, or it's not super high, or it was high and now it's starting to trend back down. Because even if we're trending back down, we don't want to go past where we're headed. We want the potassium to come back down to normal. We would also use this bag if it was a patient that we were really just trying to pull fluid off of, but their electrolytes were pretty normal. Now, 2K bags. If we're using a 2K bag, this is going to move potassium out of the patient's blood a lot quicker than a 4K bag. The potassium's high and we need to bring it down quickly. But we have to use these bags carefully because the potassium can drop quickly, and we should be checking electrolytes very frequently if the patient has a bag that is not a 4K bag hanging. Now, if you ever see a patient with a 0K bag hanging, or if your provider orders a 0K bag, you need to know that that patient has severe hyperkalemia. This is aggressive potassium removal. Now, as far as calcium, you'll commonly see a 2 calcium bag and occasionally a 0 calcium bag. This is going to be really important if your patient is on citrate for anticoagulation. Because if your patient is on citrate, citrate binds to calcium. So we have to replace the calcium separately. So when the CRT bag is 4 and 2K, it's pretty normal. We're probably more pulling fluid. We're not really doing much with the electrolytes except trying to keep them where they should be. And we're just gonna be monitoring our electrolytes in a pretty regular basis per your hospital protocol. However, if you have that 0K bag or if you have that 2K bag, you are watching those electrolytes very closely, checking them very often, and making sure that you don't pull that patient's potassium down way too quickly. And if you have a bag that's 0 calcium, your patient's probably on citrate. And if they're not, you should be asking why. Maybe it makes sense for this patient, but it at least should make you think what's going on with this patient that we would have a 0 calcium bag hanging. Continue to follow along with this series. We'll be talking all things CRT.